The use of blood pumps, which is most common in the United States and across the world to support open heart surgery, involves essentially all the time the use of continuous flow pumps, and they're effective, but we know that there are downside risks or downside accompaniments to the use of these pumps while we're doing open heart surgery, and so in effect we create an injury to allow us to treat a condition, and we hope that the injury is going to be short-lived and not associated with long-term disability, but we don't know that it will be, and sometimes it probably is.
You know, the blood vessels are not just a pipe, that they respond to the dynamic energy that's delivered to them by a pulse. When you lose this kind of regulation that is a physiologic regulation that the body has because you have non-pulsatile flow, bad things can happen.
We've learned some of the limitations of this technology over the years, and we know that the longer the patient is on this kind of support, the higher the mortality rate.
I think the current state of the art, as good as it is bad enough to justify looking for alternatives or iterative, evolutionary, revolutionary improvements.
Spinning pumps are never going to make a volume displacement type of pressure curve. So no matter how they try, it ain't going to happen. A volume displacement pump, one that has a membrane that pushes back and forth, can deliver a pulsation that is virtually identical to what comes out of the heart.
For the first time, you know, a company has come along that has designed a device that can actually generate the same type of pulsatile flow as if the heart was still in the circulation.
And people will pay large amounts of money for changes like the magnitude of those that we would project would be available with if VentriFlo can do what it seems like it can.
For the first time, there is a device that is incomparable to any other technology that we have for cardiopulmonary bypass at the moment that can potentially revolutionize how we do cardiac surgery and become the standard of care.
If VentriFlo can do what it seems like VentriFlo can do, if it can deliver on the benefits that have been promised by the preliminary work that's been done so far, I absolutely think that it can change the standard of care. And standards of care can change literally overnight.
I think it could become the standard of care. I really honestly do. I think it could change the way that all cardiac surgeons and cardiologists look at what they're doing today. And that's a very powerful idea. I mean, there aren't too many ideas like that out there that really can make an about face happen, but I think pulsatile flow might be one.